This is Into the Hen House, a podcast for moms with littles. In this space, we share the stories, experiences, and wild wisdom of mothers. We remember and celebrate the sacred. We are your hosts, Andrea and
Caitlin.
Get ready for some inspiration because it's time to jump into the hen house.
Welcome back, everyone. Welcome to our Into the Hen House podcast. We are here with the amazing kinesiologist, extra training in oral myofacial therapies, Brittany DeMarcke. We've had you on the podcast before. We talked about all things little ones, babies, infants, newborns, and a lot of oral ties and other mouth-related issues. And in that episode, for the reader or the listener who was avidly paying attention, you had mentioned that, things change in older kids and adults. And so we want to dive into that. We want to dive into what happens mouth related for those older kids and those adults. So take it away.
Okay,
Blow
so
our minds.
we talked about babies, and so concerns with babies are just like that they can breastfeed, right? And that they can feed. When it comes to oral tie releases, we're sort of limited by babies. Once they get a little bit older, you get squirmy babies and you can't really do anything, right? So there's a period of time between 6 to 8 months where we don't even talk about release anymore. We manage it another way. And now when we get into older kids, we have to consider the fact that we need to, when we're talking about myofunctional therapy specifically, we need to wait to have them come in when they're able to listen to instruction and take instruction, right? Because myofunctional therapy itself requires that we say, hey, we're going to do this exercise and I need you to do it as well, and follow a bit of a care plan in terms of exercises. So typically, keep their attention span for 5 minutes to do a couple of things twice a day. So if they cannot do that, then there's not a lot we can do from my lens, right, in our clinic. Now that kids are talking, hopefully by 3.5, eating most foods, and most of the time not breastfeeding, our concerns are a little bit different, right? So we are concerned with how their speech occurs and how it sounds. Are they intelligible? Can they hold a conversation? We do have feeding concerns around this age when kids are having picky eating or issues with choking, swallowing, food going down the wrong hole, things like that, where we would get some red flags. But what actually brings people into our office at these ages is issues with orthodontics. So their teeth are really crowded, and their dentist or their orthodontist is red flagging, or their sleep is really bad. Because we talked about it in the last podcast about how oral airway and sleep is so connected. So when we see kids, we want them to be a little bit more compliant, I guess the word would be. And then from there, 3.5, a little bit earlier with girls and with boys, all the way up to 99, because everyone needs to be able to use their mouth until the end. So yeah.
So you did talk about it a little bit on the first episode that we had you on for a parent who maybe isn't yet at the place of having been to the dentist and then the orthodontist and learning about, the palate that needs expansion. Some of the things we had talked about were picky eating, snoring, unrestful sleep, some emotional dysregulation. I think I covered them all, or at least the majority, in terms of things parents could notice and go, hey, this could be mouth related. I should go in and see someone who can work with this.
Yeah. So those would be some things. Some other things that you would see some red flags are like chronic nasal congestion. At this point, if there's chronic nasal congestion or a lot of like earaches and colds, their doctor will have sent them to an ENT. And so at this point, some people are having the conversation about adenoids and tonsils being either inflamed or enlarged. That would be a sign that you would want to come in. Mouth breathing, just in general, like if your child is a chronic mouth breather, that's a sign that something's going kind of haywire. Cavities, like if you've been to the dentist and they haven't ID'd necessarily that there's a crowding issue, but your child has cavities or they don't have any spacing between their baby teeth, that would be another sort of red flag. Speech obviously is one. Trying to think of anything else that we have on our intake form. Usually it's someone else that's referred a young kid our way, unless people will often go down like the Instagram or TikTok rabbit hole where they're hearing snoring and mouth breathing. We get that a lot. Clenching and grinding in sleep is another one. If your child is clenching and grinding, a huge red flag for oral airway at night.
Okay. Yeah, one you had mentioned too that I found really interesting and more kind of correlated to the sleep issue is the symptoms of ADHD, where there might be hyper, and Caitlin had touched on it too, but like behavioral or emotional regulation issues or what appears to be hyperactivity but is poor sleep. And the poor sleep could be tied back to, mouth, face, all of that. I thought that was really, really interesting.
Yeah, so we talked in the last episode a little bit about poor quality sleep. So when we don't have that resting tongue posture and when our mouth isn't closed, we're not breathing through our nose, we actually get less oxygenated for a number of reasons. For one, because you've got more resistance going in through the mouth than you do the nose, but also because your body doesn't produce nitric oxide, which helps with the oxygen going from the blood into the tissues, right? So when we get lower oxygen percentage in our brains, we don't sleep as well. We're not very rested. We will see a lot of wakes overnight. And so we know a lot about sleep, how important it is. If you're not getting good sleep, you're not getting full sleep cycles, you're not converting your short-term memory to long-term memory, you are not processing hormones. We know that our hormones regulate and our body sort of like flush and clean itself at night, and those things don't happen. Fun fact, bedwetting. We didn't talk about this in the last podcast, but bedwetting past the age of potty training is a sign that we're not producing leptin, which shuts down the bladder. And that happens when we are getting full quality sleep. So children who are bedwetting past that like 2.5, 3 age or past regular potty training time for whenever you guys do potty training are likely experiencing airway issues as well. Likely experiencing airway issues, which is causing poor quality sleep. Where was I going there? The bedwetting one gets me all the time. People are like, what? We're talking about behavior issues. That's what it was. So if we're not better able to learn and remember things, kids get frustrated, which means if kids are not having a good time learning, they are more likely to misbehave. But kids who are overtired have that higher level of cortisol, right? So those kids are running like this all the time. They're not as easy or not as readily able to get into that parasympathetic nervous system. So that like calming, rest and digest. When our tongue isn't in the palate, helping our vagus nerve innervate, which is responsible for that parasympathetic nervous system, and we're not getting enough sleep, so we're tired, it's almost as if we have one foot on the gas and no foot to apply the brake or the clutch. So we don't have the ability to sort of downshift into that down-regulated calming sleep. And that presents as like overactivity, always needing to move, fidgeting, inability to sit and focus. Because if you like think about it, your brain's in that fight or flight mode all the time. How can you sit and listen and learn and focus? That doesn't happen. So it's a product of poor quality sleep and that inability to get into that parasympathetic nervous system that we see when we have these airway issues.
So with sleep, because I know often when you talk ADHD and learning, you're talking more school age.
Mhm.
However, when does it kind of, and it's going to vary per kid, but when does that kind of start to shift? Because you're also talking about when you get into the deeper sleep, it will, with the bedwetting and stuff like that. So when does it start to kind of generally, in your experience, be that kids are supposed to be getting into the deeper sleep?
As in, like, what age that happens?
Yeah, kind of, because I think there's a lot of confusion because some people will think a 6-week-old should sleep all the way through the night. Some people will think a 1-year-old should sleep all the way through the night, or a 2-year-old. Um, so it's like, but kind of, let's say between that 2 years and school, like kind of
When they
in
should be
that
sleeping through.
range, kind of where does that sleep cycle start to get deeper and longer and less normal waking up during the night?
It's such a tough question, especially when we talk about breastfeeding, because we know that breastfeeding, like children that breastfeed longer in their like into their toddlerhood, will wake more frequently to breastfeed and nurse because they use that as a way to connect. This kind of bridges into that like attachment theory of like whether or not you believe your children should or should not use you as a way to regulate, right? So it's kind of hit and miss. We find that children that have higher needs in terms of regulation are also children that typically have orofacial issues.
Okay.
And the connection that I see clinically is tongue in the palate triggers vagus nerve. Vagus nerve, calming, rest, and digest. Those children are better able to settle on their own because their nervous system's a little bit more regulated. But we also see like parents that are dysregulated versus more regulated. So there's a little bit of a personality thing,
Mm-hmm.
a little bit of an orofacial component there. It's really tough. It's really tough to say. I would say that if they're not sleeping through the night past 2, there's something else going on. Because usually around 2, even if you're breastfed to that point, kids are generally sleeping and then waking up in the morning to nurse or going to bed nursing, right? Like that's where I would say probably red flag. However, waking up excessively past 1, like you're up multiple times a night, in my mind would be like something's going on here. Like this, it's to the point where their behavior is changing the next day because they've had so little sleep. That's what I would use as my guideline.
Mm-hmm.
Is like, are they waking looking rested? Can they make it to, if they're still napping, can they make it to their nap without being a complete nut job right before nap time? Like if I've got 2 boys, they're crazy. Can they make it through the evening without collapsing? We got to less on like this is a strict timeline where this should happen, and more, are we seeing red flags of them not getting enough sleep?
Right.
Is that a helpful answer?
Yes.
It is.
Because again, me personally, I'm not big about like things must be happening by here.
Yeah.
But it still is, I think, a valid question that people probably are thinking of, like.
Absolutely. Yeah.
Like,
It's nice to have some
regarding
sort
sleep.
of like guardrail or guideline.
Yeah. And then to
and
understand the red flags and kind of the like, when should I start looking and what's normal and what else do I look at?
Yeah.
Right.
Absolutely.
Yeah.
So then as they get older, and now, we've talked about bedwetting and we've talked about attention, focus, emotions. I won't go too controversial on that one. I know that in our modern Western medicine society, we like to just prescribe something for that. But from what you're saying, we could have a different issue going on that, if addressed, could I'm not going to say reverse because I'm not going to go backwards, but could help to fix this so that the problem doesn't become greater, and to get a child to a point where they are then well rested to where they can manage the needs of their day. Is that appropriate to say?
Yeah,
Okay.
absolutely. So I would say if you have attention issues And then you're also checking, are we well rested in the morning? Are we like passing out on the way home from school? Like things like that under a normal day. Obviously, like my kid had Olympics day on Friday, and so they were in the gym a ton. And I would expect that he's falling asleep, but like a lot sleepier than normal. You want to make sure that you're checking all those red flags. I would, however, hazard before, I feel like I'm safe in saying this, before choosing maybe a more medical way to manage that, if this is a concern you have, that it's not a bad idea to have their airway assessed and their sleep quality assessed. Like,
Right.
I think I think we should always go conservative before we.
Yes, before any
for
kind of
things like
a medical intervention, whether it's a prescription or a surgery or whatever. Which I imagine, without me going too far into this one, because I want to leave some space for something else here. You did kind of mention adenoids and tonsils. I think we all grew up in the time frame. We're all very similar in age. I swear half the kids I went to school with had no tonsils and no adenoids. I still have mine. It was very common, I feel like, in the early 90s to just have them taken out. You were sick often, you better get those tonsils taken out.
Ear infections, put tubes in, like that. Yeah, absolutely.
And from what you've said here, this could also be an airway related issue.
Yeah. So 2 things. Mouth breathing will cause inflammation of the tonsils.
Okay.
But we also have, and this is sort of something a problem that we have. This is a conclusion that I've come to more recently. We know that our skulls are growing narrower and narrower, right? We don't have as much space. And so when we're talking about enlarged tissues, enlarged lymphoid tissue, which is your adenoids and tonsils, they're lymphatic tissue. They help with your immune system. I think, and so if someone knows a different answer, they can call me out, but I am theorizing that the lymphoid tissue grows to what it needs to be for your body. Our skulls are not growing wide enough. And the reason why our skulls are not growing wide enough is because our tongue isn't up in that palate creating those wide arches. Plus, we are undernourished as a society. So twofold reason. So one thing that I would suggest is there's always extremes. If your adenoids and tonsils are so enlarged that we can't even attempt to get you nasal breathing, we might have to have a different conversation. However, in general, I would say getting support with changing to nasal breathing will help reduce the size of the adenoids and tonsils. And when there is a structural restriction, as in like the palate is too narrow, even at 5 years old, we're talking about palate expansion so that the structure will fit the tissues. And then that will help rather than removing the lymphatic tissue that actually helps your immune system. Because if we do that, the reality is you are weakening your immune system. And I don't think that conversation is being had with ENTs,
Right.
Unfortunately.
I won't make us have that conversation right now. That you have mentioned a few times structural restriction and palate expansion. So I think that is something we're seeing more and more of. Younger children needing palate expanders. Everyone seems to need braces and retainers and expansion in these ways. Night guards because of grinding and clenching. Take us into it. And for those listening, if you're an orthodontist or a dentist, we're not throwing shade at you. We're just offering different perspective on things.
Yeah, absolutely. So orthodontics and dentistry in general is starting to shift more to an airway focused approach. We're recognizing that some of these signs, these crooked teeth that need braces and whatever, night guards for clenching and grinding like that we're starting to recognize that there is a cause for these things, and we're offering different solutions that are a little bit more airway friendly. So we sort of talked about night guards because clenching and grinding is one of those symptoms that the airway is compromised. And the reason why we will see that clenching and grinding, particularly in kids. So when we think about kids, we think, well, they can't really be stressed. So then the idea that stress is causing clenching and grinding in adults, yeah, maybe a little bit more. But when we talk about kids, like what do they have to be stressed about? So there's got to be another issue going on here, right? And we now know that when the tongue isn't in the palate maintaining airway, creating tension in the face to keep everything open so that we can breathe really well, the jaw compensates by clenching and creating tension that the tongue should be creating. Okay. Now we think when we're clenching, we're impacting the teeth. So from the dentist perspective, they want to prevent the teeth from breaking because then they have to fix them, right? So they'll put a mouth guard in, and it's basically just a piece of plastic that acts as a shock absorber. So you can't bite down as hard and not likely to break your teeth. But the clenching and grinding doesn't go away. You're still going to do that. You're just doing it into a piece of plastic. The problem with that, and we talked about it in the last episode, is when we're breathing through our mouth, when we can't keep the lips closed and we can't keep the tongue up, we've got a lot of things to bounce off of. All the tissues in the mouth, all the like the tongue, the teeth, everything creates resistance to the air going down properly. Our nose is just a nice tube, right? The air goes straight through right to the lungs. It's very efficient. There's not a lot of resistance, but in the mouth, there is a lot of resistance when we're breathing in there because it's knocking off all the things. Now we add a mouth guard in there and we're actually creating less space for air to go through. So it has more obstruction because your tongue's probably hanging out in the way, but now we're forcing it through a smaller area, which is going to likely make the clenching and grinding worse.
Oh man, catch-22.
Right? And so I'm not saying that I'm not saying that you absolutely should never put a mouth guard in or a night guard in. What I'm saying is if you are using it because you're so at risk for breaking your teeth, that you need to be managing and actively trying to switch to nasal breathing and stabilizing your airway. We need to make a switch there. That shouldn't be a permanent solution because that's just going to make the problem worse. But as a temporary bridge to retraining the tissues to work the way they should be working, it's a great solution. But it also needs to be tailored to the person. What we fall into the trap of in orthodontics often is that here's the mouth guard, and if your jaw's this wide, this is what you're getting, or you're getting this brand, and nothing changes. It stays here, and we don't evaluate and change the thickness, change the width, or we don't make a lot of changes. They're very standard. You get a mold, and here it is, and this is how many millimeters the composite material is, and it stays that way for everyone. And you keep it in forever because you're not going to get rid of the clenching and grinding, but we got to protect your teeth. Otherwise we have to fix them. So not saying that they're the worst thing in the world. However, how we are using them needs to change. If that makes sense.
Right.
It does. And I feel like there's a bigger conversation there. That's maybe, it's not for this moment, but I'll just touch on it. Of bridging the communication and the collaboration between providers, right? Finding the dentists and orthodontists who are open to working with the airway specialists and the airway specialists who are open to working with the dentists and orthodontists, because that does go both ways, right? You can't have someone saying, no, absolutely no night guard, only working on airway, because you're right, there is also a short-term need for, no one wants cracked teeth, no one wants broken, no one wants those things.
Yeah.
So we need providers who are going to work collaboratively. And I think that why I say that's a bigger conversation, I think that's to be said across the board. It's not just between the airway specialists and the dentists and orthodontists. It's everyone, right? It's being open to working together. I do think currently in existence, we do have, airway dentists, and we do have people within each field who are more open to not just being the only solution.
Yeah.
And I think finding those people is really important, and keeping those people on your team is really important. Your team referring to like you, the listener, for your family. Have people who are open to all these things, who are willing to work together. I'm reminded, it's kind of funny. In chiropractic school, there was a guy in my class, or a couple classes behind me. His dad is a chiropractor. His mom is either a dentist or an orthodontist, and they actually created a test to determine if braces were the primary need or chiropractic was the primary need. And it actually is in dental textbooks. But like, what a unique, like, if mom runs the test in her practice and finds it's a chiropractic need, she can send them over to dad. And if dad runs the test in his practice and determines that braces are needed, he could send them over to mom. I mean, unique for their family. But I wish there were more providers who were open to that cross collaboration, to where you then have things showing up in textbooks for providers on both sides to learn.
Yeah. And honoring the person and like, instead of just saying there's a symptom, like, I love how you're talking, even just with the jaw clenching, like going back and saying, like, what a brilliant adaptation. So yes, there's this symptom. We don't want the teeth to break. That's, not great. However, this is how the body is protecting you. Like, this is the brilliant adaptation.
Right.
It just unfortunately happens to be causing pressure on your teeth.
Yeah.
And we have to look at more than just the tiny little symptom, but like zoom back a bit and look at the bigger perspective and say, how can each person play their role? What are the different elements coming
looking
into play?
at these things that we might just normally classify as a diagnosis, clencher grinder, and looking at it as a symptom of a greater whole person perspective.
Well, that's something that we do in our office. When we do our assessment, we at the end, we're like, myofunctional therapy issues are never solved in isolation. There's literally nothing, no magic thing that I could do in my office that would not also require someone else. We work so closely with orthodontists and dentists because orofacial issues come with, crowded teeth, grinding teeth. Like, we need to still address that. I have a unique perspective of being a kinesiologist too. And so I understand that fascia, it's a problem up here, but it actually covers your whole body. And so core issues, pelvic floor issues, all these other things can happen. So when we see a client, we talk about, okay, so we can help you with this. I can teach you to retrain your tongue and whatever. And in my office, not all OMTs, but I can talk about core and retraining those things and other movement mechanics. But for the most part, I'm going, okay, so you need to connect with this because your low tongue posture is causing this problem, but you also have a pelvic floor issue because the jaw and the pelvic floor are connected. So we're gonna, here's a list of people, go and find someone else, and let's build your care team with these other providers that can help you so that we're building a plan for you as a whole. Same thing we talked about with the babies is like, a lactation consultant. You need a body worker, a release provider is also in that category. And then like the oral play stuff. None of these problems happen in isolation. And I could argue that no health problem happens in isolation. It affects all different systems. And so that collaborative care is really, really important.
So your sleep apnea and your plantar fasciitis could be related because they're both fascia related.
Super cool. And I don't there's not research to support this, but I have heard of stories where people, like one specifically was like chronic left ankle problems, multiple like inversions, and it was in a brace, runner, had a tongue tie release, and all of a sudden his gait changed, never had an issue with his ankle ever again.
Because it truly is connected from the bottom of your toes to the top of your head. Yeah. Thomas Myers has an incredible book. It's called Anatomy Trains.
Love it.
Such a good one. If you're listening and you want to dive into like truly how things are connected through your fascia, that is a great, great, great book. And it has really cool pictures in it. If you're a visual person, it's beautiful.
Yeah, I love like the idea that you can pull the fascia from your toe and like it connects to your tongue. Very cool.
Yeah. I don't want to take too much of your time. We did an entire episode on infants and all the things. We've talked a lot about older kids. Adults, do we have time for adults? Can we talk about them?
Yeah, absolutely. So I often will see adults in our clinic. And at this point, when you're coming to see me as an adult, you're probably not coming to see me because you have a tongue tie. You're probably coming to see me because your sleep is not great and you're at your wit's end because nothing is working. You have sleep apnea and your CPAP's not working. You have TMJ issues, and the only way that you can survive is by going to a chiro or massage every 3-4 weeks. Usually that's it. Sometimes we'll get some feeding issues or speech issues where they've heard about myofunctional therapy and they're like, oh, maybe this will finally be the solve. But it's usually related to jaw, neck pain, and sleep are often what we see. And we've talked about why that is, right? If your tongue's not stabilizing your airway, then you're clenching and grinding, you're always going to have jaw issues. Or your tongue doesn't move independently of your jaw, so your jaw's working overtime. Those people that are really hypermobile, their tongue isn't stabilizing everything, and so the jaw moves a ton, and then we get a lot of like extra accessory movement, which wears out your TMJ, like the discs at the end of the joint. And then sleep apnea. We talked about kids who are not getting quality sleep because their airways are collapsing. It just progresses and becomes a worse problem as adults. And right now the standard of care for sleep apnea is, here are some sleep studies. If you present as having actual apneas, here's a CPAP. We'll titrate it for you, but if it doesn't work, sorry. And if you are not seen as having actual apneas, but you have upper airway resistance, which they're not often testing for, then, well, I don't know why you're so tired and miserable and why your menopause symptoms are, through the roof, or why you're grumpy and yelling at your kids because you're just not sleeping. But we can't help you. So we get a lot of people that come and they're like, look, I've just heard on TikTok or Instagram that this is maybe a thing that I should try. And so here I am.
That's you posted something a couple weeks ago on Instagram, and it was like have you experienced, or do you experience? And the list was like darkness under your eyes, and tongue scalloping was on there. There were a few others, but I went, oh my God, I need to go see her. Like, I need to go see her right now. And it wasn't like if you have all of these, it was like if you even have 1 or 2 of these, this could be an indication that your mouth is not functioning ideally, which is affecting your sleep. And I had a moment of, oh my God, me and everyone in my house need to go see Brittany.
I had that thought too.
On so many cards in the office in the last week, I've been like, you need to go see her. Oh, your tongue scalp, you need to go see her. Oh, you need to go see her. Geez, I feel like they might be starting to think, do you get kickbacks from this? No, I don't. I've just learned something. It's very exciting, and I currently feel like everyone needs to see you. So,
well, it's like, it's so crazy because when you think about doing therapy, you're thinking of like physiotherapy where you're spending half an hour to an hour to do exercises, right? Like if you have an injury, it's an intensive process. Myofunctional therapy, it's life-changing because there's a lot of different things that we talk about that you could change that could improve your health. But in terms of the actual rehab that we do, we spend 5 minutes twice a day.
Okay.
10 minutes in total. 10 minutes in total of retraining the way your tongue and your face moves. And you could improve your sleep significantly.
Which, from everything we've talked about, means you could improve your life significantly.
Right.
I think we could all probably most definitely carve out 10 minutes a day for that.
Right. And I think for moms too, that's life-changing, because how often is it? It's like finally kids are all sleeping through the night and doing great, and you're like awake and can't get comfortable and just can't sleep, and the air kicks on in the house because it finally got colder, and then you can't breathe, and then like you hear that a lot from moms too. They're like, great, the kids are sleeping and now I can't sleep.
Absolutely. And one thing that happens that I've recognized in women is once you have kids, everything is a little bit looser, right? Like your joints have to accommodate that baby growth and then birth or delivery. And that makes a lot of these issues a little bit worse, a little bit more prominent. And the changes in hormones, because if you're not sleeping properly, your body's ability to regulate your hormones gets a little bit worse. And so you pair that, you're more flexible, your hormones are already out of whack. And then we add in that you're not sleeping and like life just collapses. Like it's so much harder to parent from that position, right? So, yeah.
Also, for all the moms who can relate to this, I feel like this is one I hear a lot and have experienced. Your kids wake you up and your husband snoring keeps you up. So yes. for all the moms who dad is keeping you up at night, send him in for an airway assessment too.
Right.
Yeah, we can work on snoring. It should just be that you snore and that's what you do. You're just a snorer. Like that's actual dysfunction. People just don't realize it.
Well, yeah. Brittany, I am like past my capacity for learning new things today. This has been really amazing. Andrea, is there anything else that you are feeling like you want to throw out, that you want to ask, that you want?
No, I think this was really great. I'm like, I need to find out if there's someone here, because not that I'm opposed to going to Manitoba to see you, because I would.
It's a little bit of a trip.
But it's a bit of a trip, yeah.
We offer virtual options.
Okay. Oh, that's really cool. Okay.
Well, Brittany, thank you. Truly thank you for sharing so much knowledge and expertise, not just once, but twice with us. We've really appreciated you being here and all of your time. And we will make sure to include your name and your contact information, how people can find you, and those qualifications, so that if people do want to work with someone locally, they know what they're looking for closer to home. But we do want to make sure that people can connect with you. And for all of our listeners, we really hope that you've got as much out of this as we have, because, wow, it's been really enlightening. So thank you.
Thanks for having me. It was great.
Thank you so much. Thank you.
Bye, everyone. Until next time.
Thank you so much for listening. If you are loving this podcast, please go ahead and subscribe and leave us a review. Both of these really help the show. As you go out into the world this week, know that we are sending you so much love and wishing you a wonderful and beautiful day. And we will see you back here soon.